The mitral valve is one of the 4 valves in your heart. Heart valves have flaps that open and close. The flaps make sure that blood flows in the right direction through your heart and to the rest of your body. When your heart beats, the flaps open to let blood through. Between heartbeats, they close to stop the blood from flowing backwards. The mitral valve opens to let blood flow from your heart's upper left chamber to the lower left chamber. When the lower left chamber contracts, squeezes, to pump blood to your body, the mitral valve closes tightly to keep any blood from flowing backwards. What is mitral valve prolapse? Mitral valve prolapse, MVP, happens when the flaps of the mitral valve become floppy and don't close tightly. In some cases, blood may leak backwards through the valve to the chamber it came from. This is called backflow or regurgitation. When there is a lot of mitral valve backflow, the heart can't push enough blood out to the body. But most people who have MVP don't have any backflow. In fact, MVP doesn't cause any health problems for most people who have it. Anyone can have MVP. Most people who have it were born with it. MVP tends to run in families, but researchers don't know the exact cause. You may be more likely to develop MVP if you are older. The risk of MVP increases as aging affects the valve. Had rheumatic fever, a disease that can develop after a strep throat infection and cause damage to the heart valves. Were born with a connective tissue disorder, such as Marfan syndrome or Ehlers-Danlos syndrome. Have Graves' disease, a type of thyroid condition. Have scoliosis, a side-to-side curve of the spine. Or other problems with the bones of your body. Have some types of muscular dystrophy. Mitral valve prolapse with backflow is most common in men and people who have high blood pressure. What are the symptoms of mitral valve prolapse, MVP? Most people who have MVP don't have any symptoms. But if it does cause symptoms, they may include heart palpitations, feeling that your heart is fluttering, skipping beats, or beating too hard or too fast, shortness of breath, feeling like you can't get enough air, a cough, fatigue, dizziness or anxiety, a migraine, chest pain,